Hello, I'm Alex Govsek, and this is CMS Quality Strategy, Tournament of Experts. Before we begin, let's take a moment to meet our contestants. The Quality Measurement and Health Assessment Director and Measures enthusiast who enjoys doctoring on weekends at GW Hospital from CMS in Baltimore, Maryland, Dr. Kate Goodrich. Contestant number 2 from Baltimore, Maryland, Dr. LaWanda Burwell, a research analyst who evaluates how organizations are performing for fun. And contestant number 3, senior advisor, political analyst, and football mom from CMS in Baltimore, Maryland, Samantha Richardson. Let's hear it for our contestant. Today's categories are making care safer, person and family engagement, effective communication and coordination of care, effective prevention and treatment, healthy living, and making care affordable. Dr. Goodrich, since you are our returning champion, you get to select the first category.
Well, thank you, Alex. I think I'm going to go with making care safer for 400.
These are the 3 objectives for making care safer.
What are improve support for a culture of safety, reduce inappropriate and unnecessary care, and, prevent or minimize harm in all settings?
Well done, Dr. Goodrich. You're on the board with 400. These objectives will help CMS improve achievement of patient-centered goals, attribute reduced costs to the reduction of unnecessary, duplicative, and inappropriate care, reduce hospital-acquired conditions and healthcare-associated infections, and decrease falls.
Oh, and Alex, don't forget improving medication error rates.
Whoa, showing up the host? I'm not sure we can accept that. Judges? No, I'm sorry. Looks like you'll lose your turn. LaWanda, over to you.
Oh, okay. I'd like effective communication and coordination of care for 600.
And you found our first quadruple quality query. Remember, a correct response here will be worth 4 times the amount of your wager. Since you don't have anything on the board yet, the most you can wager is 500.
I'd wager way more than that, Alex. Effective communication and coordination of care is a valuable tool in making sure that patients and families are engaged in not only the care, but in transitions from provider to other settings. I'll go with 1,000.
I'm sure it's an important aspect of care strategy, but the rules are, never mind. Let's get to the answer. And remember, the category is effective communication and coordination of care. This practice allows us to reduce admissions and readmissions, embed best practices to manage transitions, and enable effective healthcare system navigation.
Effective communication and coordination of care.
I'm sorry, your response must be phrased in the form of a question. Samantha?
What is effective communication and coordination of care?
That is correct. Seeing something that needs to be done and doing it. We can
measure and publicly report readmission rates, standardize transition processes, promote best practices, and enable appropriate and timely follow-up care.
We need to go to a break to review the conduct rules with our contestants. But let me leave you with a few things to think about.